Hello, and once again, this is Dr. J at ATG IVF Center. I'll be talking about IUI today, for short, intrauterine insemination. So listen attentively. So intrauterine insemination, basically, is a fertility procedure where we wash the husband's sperm, okay? It's placed directly into the uterus, into the womb cavity at the time of ovulation by bypassing the cervix and giving the sperm a head start to reach the egg. Why do we do IUI? It's recommended for couples who have unexplained infertility, especially where male factor is a problem. When there's male issues with the motility of the sperm. When we do sperm analysis, we check for three things most importantly, amongst other things: motility, morphology, and the concentration of the sperm. When or sometimes if the cervical mucus of the woman is the problem, not allowing sperm to bypass and get into the womb cavity to fertilize the egg. And sometimes for women that need donor sperm, or women that are in a relationship where they need donor sperm and they are ovulating well, IUI might be what they need. What is the difference between IUI and IVF? IVF uses pure hormones, but IUI, in most cases, we just time the woman when she's having natural ovulation and we do the IUI. Sometimes we can use some medications to stimulate, sometimes during IUI to achieve more production of eggs, for so many other reasons. But essentially, IUI, you might not want to use hormones, or you might use hormones depending, but in IVF, definitely you got to stimulate, so it's hormonal based. Now, what is the role of monitoring during IUI? Timing is important for everything. During IUI, we want to ensure that the time where we are putting this, obviously the semen in, you are ovulating, okay? And it's scheduled to be around the time of ovulation, whether natural ovulation, or if we use clomid or letrozole, or even injectable gonadotropins to stimulate your eggs to maximize the chances of IUI. In IUI, we do sperm washing. What does it mean? Sometimes maybe a couple, they have maybe one the husband is HIV positive, God forbid, we can wash the sperm, because we want to show that we're reducing the chances of them or the other person contracting HIV. So we wash the sperm, prepare the sperm, and then we'll do IUI for such purpose. That could be a reason why we're doing IUI. That's an indication for doing IUI when a partner or the husband is HIV positive, or even hepatitis B as well. But most importantly, most common reason for in this sort of case, it could be HIV positivity. So we wash the sperm, make the sperm concentrated, and capacitate the sperm to move, and then we can use it to fertilize. Okay, and the procedure is very quick; doesn't take too much time. It can be done while you're awake. You don't have to be under cautious sedation like IVF, and sometimes too, you might even do your cervical smear during the IUI. It's important that we do by the vaginal smear test, vaginal swab, to check for infections prior to the IUI, because we don't want to then put infection there. Or if there's infection, they want to treat it before we proceed to the IUI. So, the sperm is gently deposited through the cervix into the womb cavity and encouraged to move to go and meet the egg. Now, the procedure itself, the success rate is a bit low, about 20 to 30%. But a lot of factors determine the success rate: age of the patient, and whether there are other issues like fibroids, polyp in the womb cavity. So before you do IUI, you need ultrasound scan, or even, if possible, hysteroscopy, to check that there's no intrauterine mass like polyp, fibroid in the womb that could impede or make fertilization difficult to achieve. Now, IUI itself, I would suggest that if you're going for IUI, you shouldn't do it for more than 3 to 6 attempts. Once it's beyond that, stop it. In fact, by the time you get to the time of doing IUI for the third time, start thinking of doing proper IVF, because not all couples will be successful. Apart from that, IUI is not for everybody. Though it's cheaper than IVF, some couples need to go for IVF straight away, and they should not waste time for IUI. About a patient who's done IVF somewhere else with us, it didn't work out, she wants to go for IUI. I told her, if you've got 2 or 1 failed IVF, you can't go back to IUI, because you have to go for the next IVF. In fact, you might even need to consider using sperm donor, egg donor, whatever, and even do hysteroscopy prior to the next IVF attempt in such a case as I described. Now, IUI itself is the risks are very, very minimal because we're not usually using full stimulation like we do for IVF. There's less risk of you developing what we call ovarian hyperstimulation syndrome. There's less risk of other complications hormonal because we are using very, very low hormone. But at some point, if you've done IUI about 3 to 6 cycles, especially about 3, and it's not working, you need to abandon that procedure and move straightforward to IVF. So stay tuned and listen to me all the time. So IUI itself can be the first step to treating couples with unexplained infertility before they go for IVF in such situation and such times. In fact, another thing why people do IUI is because maybe now the woman is okay, she's not having issues, but the husband is not in Nigeria, it's not in diaspora, it comes home once in a while. IUI might be for you because you might want to use frozen sperm from your husband and then do IUI at your own free time. We do that at our office in ATG, and you can explore that option if your husband is in diaspora and everything is fine, the sperm is okay, you're ovulating well, you got no other problems. So stay tuned and listen to me all the time at ATG IVF Dr. J here once again. Have a wonderful day. Bye-bye.